is the All of Us research study that's run by the NIH. It was started under the Obama administration, and it's a goal to reach 1 million participants, and it's powered well. So it's tried to be inclusive of all different types of conditions and also all different types of, diverse backgrounds and ethnicities. And it's aiming to, basically getting a cohort of 1 million people to have some of their health information shared so that it could be used for future study in that mass database. So I've always been following them and excited about that study. But, otherwise, there's obviously existing national surveillance, public health surveillance systems and reporting surveys that come out every year, like the behavior study among young people. And so those are some of the data sources that we have to draw on at that national level. But I think there's many more exciting things that we could do and still maintain patient privacy.
Absolutely. Where do those data sets come from? And I know we're kind of getting in the weeds a little bit, but this is great information for our listeners to understand. And by the way, thank you all so much for joining us here today on the Veterans for Cannabis podcast. I have a wonderful guest, Dr. McNabb, today. She is president of the Cannabis Center of Excellence Incorporated. Dr. McNabb, so when we talk about the information that's being pulled from the public health side now, where are they getting that from? From the insurance providers?
Well, I think there's a variety of data sources that are out there. So there's a lot of different registries depending on health conditions. So there's like cancer registries and data sets and, independent around those conditions. Then there's also just standard national surveys that are done either through school systems. So the BRFSS, for example, is a youth survey.
Very interesting. Okay.
Yeah. And interestingly, a lot of the cannabis data about, comes from some of those surveys, but that are done every year, every couple of years.
I always wonder, where did they get that, 12 to 15-year-olds cannabis use is going down? Where the hell does that come from,
Yeah, it's from those surveys.
Okay.
So they ask particular questions about, cannabis use or other substances, alcohol use. And they do those same studies or same surveys, annually or every couple of years to understand the trends.
Wow. It's amazing. It's so, especially with your public health background and epidemiology and what it has to be done to figure out the information, like especially with COVID, where we're at right now, finding out that contact tracing, right? But it all comes down to the same thing. We're talking about the cannabis side of it, looking at the research that's backing it up. So if we're unequivocally saying that in a recreational state, cannabis use in teens is going down, that's data that's solid that needs to be found. And I'm glad that they can at least access it. But if we can find a better way to, bring it all together in one central location so that the layman could get it, like how does somebody like me just log in and find out, okay, what is a 20 through 25-year-old cannabis user look like? You can't really.
Yeah, you can't right now.
Right.
And some of those other studies that you talked about, like in rec states, cannabis use going down, a lot of those might be independent research studies,
Right.
Led by different university investigators that draw upon data sources that I mentioned, or maybe doing their own. There's obviously also state level, regular routine public health surveys that happen, not just federal level. But there is no, it's very hard for a layperson to get out there and understand the evidence. I think for cannabis specifically, it's like you can think about it like there's the side of a prohibitionist on the left,
Sure.
and then there's a cannabis researcher in the middle that's trying to understand objectively what's happening.
Right.
And then there's the people that are very pro. And so,
let me tell you
finding that
why.
balance.
Absolutely. Let me tell you why I made that comment. It's because when I first started doing this advocacy work 4, 5, 6 years ago now, I could not find data anywhere to back up the claims that I was saying, So it was so frustrating to me that I know anecdotally how well this is working for me and a lot of my brothers and sisters in the veteran community, but I couldn't find that information anywhere, and I was so frustrated with it that and who we are as Veterans for Cannabis we're advocates. We try to teach our listeners that are out there right now how to advocate at the local level, the state level, the federal level, and having that data makes them that much more powerful, right? And that's a big issue that we find.
Yeah, absolutely. And I think that stems into the fact that cannabis is obviously federally illegal, and many of these academic institutions receive federal support. So they are completely prohibited from touching anything cannabis.
Sure.
And it's obviously university or academic system, they each have their own, are they going to go out there or not? But because of that, there's no federal grants. There's not a lot of private philanthropy unless it's like a really large donor, maybe to one specific research group, but there's not grants out there. This is the struggle that I faced over the last 3.5 years of how do you
let's get right into it.
Funding.
Let's get into it. You had an amazing study done with UMass Dartmouth. Is that correct?
Yes.
So what did you guys focus on? Was it a veteran study, patient study? What are we looking at here?
Yeah, so interestingly, because of what I just described, so I started Cannabis Community Care and Research Network, which is predecessor to the Cannabis Center of Excellence, about 3.5 years ago with my business partner, Randy McCaffrey. And we started in Massachusetts when it became legal for rec, and we advocated, just like you do, for several parts of the industry in Massachusetts. So we advocated for research licenses and allowing academics to, study the plan at a state level. We advocated for high quality education and bringing together industry, academia, policy makers, consumers, and patients to design and deliver high quality education programs. And then we also advocated for social justice and to right the wrongs of the drug war. So as we were advocating at the local level and state level when they were designing the regulations, designing the Cannabis Control Commission, I got an email from UMass Dartmouth from a professor, and he reached out and said, look, I really want to study cannabis, but I can't really do it as myself in UMass Dartmouth because I can't have collaborations with the industry directly because I'm losing federal funding, right?
Oh my
because
gosh,
I'm losing federal
frustrating.
funding.
Right.
Very. So he reached out and said, hey, you're an academic, and we had designed our company with this in mind, understanding that, we could serve as a middle layer, so to speak, between industry and academics and policymakers to try and be a third party that could work together. So Professor White at UMass Dartmouth, reached out and said, let's do some research together. So we started a couple years ago with the Open Cannabis Consumer and Patient Study. And what that study was really just trying to understand why do patients and consumers consume cannabis? Are you consuming it for health conditions? And if so, what conditions? How is it helpful for you? Do you see any adverse side effects? How do you purchase? How do you like to consume? Do you prefer flower, vape, edibles? And then also ask stigma-related issues. So, are you fearful of your workplace testing?
Right.
Or your family knowing, that kind of stuff. And then barriers and access to cannabis.
Sure.
We also asked, interestingly, and when I started C3N a long time ago, one of the big driving science inquiries I had is the impact of cannabis on the opioid epidemic. And could cannabis be considered an alternative medication? So
I tell you, one thing that stuck out to me the most is when I look at the graphs, I look at the data, and when I read through this study, and I say this all the time, that let me step off for a second. We got just a couple more minutes on this first one. So we're going to do this as a 2-part podcast, guys. So join us for the second part of that. When I looked at that, and I talk about it all the time, that about 70 to 80% of the veterans that I know in our network have chronic pain that's associated with PTS. When I look at the graph and the data, it absolutely backs everything up that I see, that we've seen anecdotally. When I see your graphs and your data, it says chronic pain about the number one use. I'm like, yes, this is exactly what we've been saying.
Yes. It is, yes. So after we had conducted that first study, we found in just the general patient and consumer population that over 70% were using cannabis actively or in the past to reduce unwanted prescription or over-the-counter medications. And as a public health professional, I was shocked. I was like, okay, this is actually a really big deal.
Right.
And we should really be considering cannabis as a harm reduction and an alternative to those that don't want to be on some of these medications that have really unwanted side effects.
Preach it, young lady. Preach it.
And so actually that's what we did. We hosted 6 events in Massachusetts, and we released this data and this information, and we were like, this is a problem. And we partnered with different dispensaries to help support the study, and we actually tried to take it to a new level. So as a public health researcher, I don't only like to collect data and then analyze it and put it into some peer-reviewed publication. I'm a very action-oriented public health person. So
absolutely,
we took that findings and we said, you know what, this is a real issue. We hosted events around it. We said, we really need to think about this. We went to our dispensary partners and actually presented the data back to the patient populations that reported their anonymous data so that they could feel engaged as part of the process. And I have some amazing, heartwarming stories about those events and some of the patients that we touched.
Well, I think that's perfect. I think that's exactly where we pause right now. We'll pause for the cause, as a wonderful friend of mine used to say on his podcast. We're going to transition to part 2. So, everybody, you're joining us here on the Veterans for Cannabis podcast. I'm Joshua Littrell, your host, and we have an amazing guest, Dr. McNabb. She's president of the Cannabis Center of Excellence Incorporated. Join us for part 2 next.
Line over there, over there. Send the word over there. That the Yanks are coming, the Yanks are coming. The drums rum-tumming everywhere. So prepare, say a prayer. Send the word to beware. We'll be over, we're coming over, and we won't come back till it's over there, over there.